Welcome back, loves, to the Anxiety and Free podcast. I'm your host, Marquita Myrick, and I am yet again recording this very late at night. It is almost midnight to be exact. I digress. Let's talk about the best natural anxiety remedies for 2025. And before I go there, I just want to remind you that in the last episode, I broke down my strategy for even figuring out what part of a person's anxiety to treat, how long that anxiety has been there, how long it's manifested in their life cycle. Did anyone in their family have anxiety? So I really broke down that strategy. If you haven't listened to that episode, go back and listen to that one before you listen to this one, because this one builds upon that one. So today I thought it would be a great idea to talk about the best natural remedies for 2025. However, I'm also going to talk about a less natural remedy in this episode because I think it's important to talk about that too. So let's talk about first establishing whether or not a person wants to take that natural path and or if they want to add some medication to that. I mentioned in the last episode that I am not a medication prescriber. Okay. I have plenty of people I can refer you to. And that is part of being a good psychotherapist, is recognizing when people's anxiety symptoms have just gotten out of hand and they could use a little bit of help. And I want to also say that even if you feel like your anxiety is not out of hand, however, it's still bothersome to you, it's still worth it to get a consultation for psychiatric medication. Now, when we talk about psychotropics, that's your anxiety medication, depression medication, antipsychotic medications, they're all lumped under that category. Again, I mentioned that I can't prescribe it. However, what I do is provide education on what it does for people, which is take the edge off. So I have been on anxiety medication previously. I think the last time was over 10 years ago. I haven't been on psychotropics for an entire decade. Yes, I do celebrate that often because it took a lot of work for me to get off of medication myself, even as a psychotherapist. And if you are on medication right now and you're hearing this, I don't want you to hear that it's bad. Okay. It's a good thing if you decide you want some help and you actually bring yourself to the point where you're willing to go out and get it. So for me, I wanted to move forward through life knowing that I had developed the skills to make sure I could manage anxiety in the long term. So that's why I got off of it, because I, for lack of a better word, mastered the natural skills that I'm going to share with you today. They are skills that I practice every day. So going back to psychotropics though, I'm not pushy in my practice. I just gently let people know your symptoms are moderate to severe. Again, we looked at that GAD-7. We looked at the psychosocial. I gathered the information from the consultation, qualitative and quantitative data, and determined, yeah, this person could really benefit from medication. So I'm going to have that conversation with them. And a lot of people in my practice, most actually, let me know that they want to take the natural route, and I fully support that. So when we're taking that natural route, what are some of the strategies that I run through with people? Well, I'm about to tell you. So I'm so glad you asked. All right. Mindfulness and deep breathing. That is huge. Mindfulness is an awareness process where you are becoming more aware of yourself, your body, your surroundings. That might also involve some grounding exercises, just really becoming in tune with your body and what it feels like when it has anxiety, and also what it feels like when anxiety is not so present. I think you owe it to yourself to become more acquainted with your body as it relates to your anxiety experience, because we can't fully get rid of anxiety. I mentioned this in the last episode. We actually need it to help keep us alive. So understanding when it's out of control versus when it's a form of anxiety that you actually need to help you stay prepared, to keep you on your toes, to keep you safe in extreme circumstances, or maybe not extreme sometimes, you need it. So mindfulness is so important for that process. The next thing that I talk to people about are breathing exercises. Now, some people like box breathing, teach the 4-7-8 breathing technique, and you can go Google that. It is a technique that I practice throughout the day, and it works so well. The goal is to get up to 8 rounds of it. I finally made it up to 8 rounds. For years, I stayed stuck at 4 rounds of it. And the key to doing any deep breathing exercise specifically, is doing it consistently when you're having anxiety, when you're symptomatic, and when you're asymptomatic, right? We want to retrain your body and your brain to relax, even without you having to actively tell yourself, I need to practice this breathing exercise. So deep breathing is so important. And just so you know, I want to quickly go over it. With the 4-7-8 breathing technique, you're breathing in for 4 seconds. you're holding it for 7 seconds and you're releasing it for 8 seconds. And that's what you're doing up to 8 times. Now, I have had clients who said that was too long for me. And believe it or not, 4, 7, and 8 seconds can actually feel long when you're dealing with anxiety. So look, love, whatever you need to do to break it down for yourself, go for it. If you need to do 4, 4, 4, if you need to do 2, 2, 2, do that. When I talk to my children about managing anxiety, we actually just do 2, 2, 2, because for a young child, holding their breath for 4 seconds, or 7 seconds rather, it's too long for them. So we had to break it down. So if you're at the beginning of your anxiety treatment journey, don't be afraid to modify this to your preferences. The next thing I want to talk to you about is cognitive behavioral therapy skills. Now, I have to say that I know so many therapists who are against CBT. That's what it is for short. And they say, you know what? It doesn't respect the client experience. It talks about irrational thoughts and beliefs. And yes, it does. If you look up traditional CBT, you will see your thoughts are irrational. What I tell people is I still practice all of the skills that worked for me in 2002 and beyond when I was being treated for obsessive compulsive disorder. So that being said, I teach it the traditional way. I just modify and I let people know, look, your thoughts are actually rational. Maybe you are anxious about losing your job and someone else may say, well, you do a really good job in your career, so I don't understand why you're so anxious about it. However, 4 of your coworkers just got let go. So you're not having irrational thoughts. These are very rational, especially in these times. We're hearing of mass layoffs. It's a very rational fear for you. So that's why I teach cognitive behavioral therapy in a way where we are discussing your thoughts as rational and not irrational. Now, certainly there are some circumstances, there are some diagnoses where the thoughts would be more irrational, such as the case with obsessive compulsive disorder, a diagnosis that I have had since the age of 19. And if someone has a psychotic disorder, well, yeah, those thoughts are going to be more irrational, right? Those are different symptoms that the brain is bringing up. And it feels like torment, to be honest. If you have OCD, I don't have a psychotic disorder. I have had OCD and lived with that and also been medication free for 10 years on the OCD side. So I'm also happy to share that with you. There is hope. Okay. So nevertheless, if you are having irrational thoughts, that is something that your therapist could explore with you. If you said, you know what, Marquita, I understand that you're saying my thoughts are rational and I understand that you want to be validating in that way. However, I actually don't think they're rational. I think they're irrational. So that's something you can go over with your therapist. Or if you're one of my clients listening to this, you can go over that with me in your next session. But CBT is so helpful for that because we go through cognitive restructuring. We talk about thought stopping, thought reframing, thought relabeling. I love the idea of visualizing the stop sign. That's also a CBT skill. With cognitive restructuring, you're really looking to restructure your cognitions, your thinking patterns, how those thoughts come in, how you process them. CBT is wonderful for that. Now, the next thing is positive psychology, which I also love because while people are practicing these skills, it is hard. Okay. I'll just say it now. There's so much repetition involved in mastering these skills and even just getting a handle on them in week 1 of therapy. Okay. That's why we try not to overwhelm people with how many skills we share with them. So for the purposes of this podcast episode, I want you to understand that positive psychology is important in any journey where any diagnosis is being addressed as it relates to your mental health and mental illnesses. So positive psychology came along because there were a lot of therapeutic modalities treating maladaptive behaviors, negative thoughts, right? Trauma. And when positive psychology came along, the creator of that thought, well, what about the positive things in life? What about the good experiences people are having? We're giving no attention to those things. We're just treating negative symptoms. Okay. So positive psychology is all about focusing on the things that you value, practicing gratitude, actually developing a habit of practicing gratitude, which is something I do often. And it just puts a smile on my face. It makes me feel better. So even if you're the person who's fearing losing your job, I'm pretty sure you can still find 5 to 10 things that you're grateful for. And that practice will take you very far when it comes to navigating your anxiety experience. Next up, repetition. The things that I have mentioned and I will continue to mention, none of it works if you don't do it repeatedly. I've already said that if you are really going to manage your anxiety and master it, for lack of a better word, doing these skills when you are having the symptoms and when you aren't. And what I mean by that is things are fine. You don't feel anxious. You don't feel sad. You are not angry about anything. You are just happy. you are you are in the highest state of love and happiness that you can be. You still need to practice the skills because you want to train your brain on an ongoing basis to practice these skills. On that note, when you're doing that, when you're training your brain in that way, when you do have anxiety, what do you think your brain does? What do you think your body does? You may instantly just start grounding yourself. You may instantly just start practicing deep breathing. You may instantly have a negative thought that typically causes you to experience anxiety, and you practice some CBT skills. You practice thought stopping, thought relabeling. You may go through the whole cognitive restructuring worksheet because you have trained your body. You don't have to work so hard when you're practicing these skills repeatedly. And I get it. It can sound overwhelming. And I let people know that in therapy. Okay, it's going to be overwhelming the first week or two. And once you start to experience that relief, I can almost promise you, you're going to become addicted with these skills, addicted to practicing these skills. And that's where I'm at with my own anxiety journey. I just practice these skills throughout the day. All right, next up. And you know what? I should have mentioned this in the beginning. There's a surprise bonus tip at the end. So you want to finish listening to this episode so you can hear that one. I'll just give you a hint. If you are a believer, you're going to love it. All right. Jumping back in, behavioral changes. I can give you all the skills in the world and encourage you to practice them. And you can try them. You can even be consistent in trying them when you're happy and when you're not. And if you're not watching the people, places, or activities that you're engaging in, you might not experience some relief, okay? So some people really do need to leave their job. And that's the hard part about being a therapist because sometimes people will come with anxiety and it is very clear where it's coming from. Other times, they think it's coming from one place and it's actually not. And we have to do some deep exploring, go into the childhood themes and patterns and just kind of reverse engineer how this anxiety got to the place it's in. And then we do that and discover, oh, it's actually not your job. It's self-esteem issues that originated in childhood, right? So when that happens though, we are getting down to the root of it. And sometimes the root of it is something you don't want to hear. Sometimes the root of it is that job and it's just not working for you. Sometimes the root of it is you really need to take a look at your intimate relationship and decide whether or not being partnered with that person is good for your overall health, mental health, physical health, all the things. Sometimes the friends you're hanging around, you need to let them go. You need to release them. They are not bringing anything positive to your life. And when they are, it's just too far in between. So sometimes it's parenting and you don't have enough support, and that doesn't feel right to say that out loud. However, that's just the reality for some people. By the way, I have 2 kids, so in general, parenting is a lot. I understand that, and I make sure to normalize that for people. If you're having anxiety stemming from parenting, whether or not you're doing it solo or you have support and that support doesn't come until a certain time of day, it's still anxiety provoking. So there are only so many ways we can navigate that, right? I will say there are a lot of behavioral changes you can make when it comes to the people, the places, the activities. And so sometimes you need to temporarily alter your relationship patterns and where you go, where you show up at in the world, how long you show up at these places or in these relationships, how long you talk on the phone to that one friend who's super negative and always activates your anxiety, how long you talk to family members who activate your anxiety, how long you sit down and play games with your kids. Maybe that's something you need to take a look at. Maybe it's bringing you anxiety because it's bringing up a childhood trauma for you of some sort, and you need to behaviorally work your way around that. And you can still sit down and play with them, but you have to give yourself a time limit, 10 minutes, and then you let them paint. You're no longer playing that game, right? Until you work through that in therapy and really work to resolve that childhood trauma. I'm just trying to give you ideas because I work with so many people and there are so many ideas that come to mind as it relates to anxiety. And by the way, I'm not thinking about anyone in particular. My brain, is neurodivergent because I do have OCD, so I can think of examples on the fly. Okay. Just want to make sure we put that disclaimer there because I'm never bringing direct client information into this podcast. I am, however, bringing certain themes from the work that I have done over the last 15 years. All right. So now after we look at those behavioral changes, which by the way, I understand if you can't change any of them, immediately. Just throw that out there. Then we move on to worksheets. And I like to give the worksheets to reinforce what we're discussing in therapy. So I give an anxiety coping skills worksheet. I give worksheets on cognitive restructuring, which is underneath the umbrella of cognitive behavioral therapy. And sometimes I give no worksheets at all. Why is that? Some people are not worksheet people and they let me know. And even if they don't let me know, I let them know. You can tell me no. Okay. That may be a part of managing your anxiety, a part of building your self confidence. You're practicing that in therapy. I'm always encouraging people to tell me no when they need to tell me no. Nope, Marquita, you gave me 2 skills today. That's enough. I can't take anymore. Maybe next session, give me your next best 2 skills to manage my anxiety. But for right now, I'm going to stick with the mindfulness and deep breathing. I'm going to stick with that for week 1. Cool, no problem. So worksheets are a nice supplement to the work we do, especially if you can't schedule weekly. I have a lot of people who schedule every 2 weeks or they schedule once a month or once every 2 months. So in the beginning of your anxiety management journey, it is best if you schedule regularly, as in once a week, especially depending on the severity of your symptoms. However, that just doesn't work for everyone's budget. Or some people work jobs where they just really can't pull away because maybe it's a busy season. So what the worksheets do is it gives you something to work on, something that you can print out and hold and look at and hold yourself accountable with until your next session. So again, if you are a worksheet person, ask your therapist for worksheets, and if you're not a worksheet person, be honest with your therapist and let them know, look, you can give me all the worksheets you want. I am not going to open them. I'm not going to download them. Look, it is your therapeutic journey. So we just want what's best for you. And not everyone learns with worksheets. Some people, a lot of my clients actually take notes during session, which I love. You just see people scribbling a lot as they're having these moments of insight. And that's such a beautiful part of therapy. I just smile internally and externally when they do that because it's almost like you're the student in school and you're just taking in all these notes, taking in all these themes, all these lessons, and you're ready to run off and apply them. In the case of being in school, thinking of college specifically, you have to go off and study those lessons, right? Some people pull all-nighters. I don't want you pulling all-nighters because when it comes to anxiety, you probably are already staying up late because anxiety is keeping you up. What matters is that you're absorbing the information we're discussing in session. You're asking the questions you need to ask to make this experience unique for you. Or maybe you don't want to start with deep breathing. Okay. We need to make it unique for you. Maybe you're a person who says I need to get deep into the heavier skills first. Okay. Maybe you're a person who says, look, after this intake session, I will contact that psychiatrist and or psychiatric nurse practitioner that you referred me to, and I will explore medication. That's going to be my next step after this intake session. Whatever it is, it just has to be unique because everyone has a unique story and needs a unique treatment approach. Okay. Are you ready for the last thing that I told you you would love if you are a believer such as myself? And I think even if you're not a believer, maybe it will inspire you to explore your belief system. Okay. So in the Bible, 2 Timothy 1:7, it reads, "For God has not given us a spirit of fear and timidity, but of power, love, and self-discipline." So this is a verse that I come back to. And by the way, that's the New Living Translation. It's a verse I come back to often when I think about anxiety. We're all going to have anxiety. It's a part of our human experience, right? And God has not given us the spirit of fear. And so I lean on that at times when I'm anxious. And yes, I still get anxious. It just doesn't get out of control because I have all these skills I practice. However, if we're really taking this to heart, then what it translates to me is that we lean on God when we have that fear. And ultimately, does that cure it overnight or right away? Not always, right? It's just, I love the idea of submitting to God, submitting to a higher power, these anxiety experiences, because He created us. So why not submit it to Him? Why not lean on the hope of that scripture? We don't have the spirit of fear and timidity. The timidity part, when I think about that, I think about the fact that even for myself, when I first went to therapy, I was very timid with it. I came from a family where I didn't even know what therapy was until I got to college at the University of Colorado at Boulder. And then I learned what therapy was. And then I decided to conquer my fear, right? That spirit of fear, and conquer my timidity and explore it. What is this? How can it help me? I'm so glad I did that because during that process, I was a very timid person and I became a person who was more outspoken and now I have a podcast, right? Go figure. So, really working on your anxiety and your humanness, practicing the skills we discussed today, and then submitting that anxiety to God because He has not given us a spirit of fear and timidity, but of power, love, and self discipline. I think it just enhances your anxiety journey when you're really submitting to Him. I really hope you enjoyed this episode where we discuss the best natural anxiety remedies for 2025. There are more. I'll say that when I brainstormed for this episode, these are the things that immediately stood out. Of course, I go through people's childhood. I look at how anxiety shows up in their family, how anxiety shows up in their partner, and how that rubs off on them, and how they have to tiptoe around their partner's anxiety. I'm sharing this because there's more to it, and it's all based on your individual needs in therapy and the way you show up in the world and your needs in the world and how you negotiate the meeting of your needs in each relationship, in each moment, in each sector of your life. It's so important that you manage your anxiety. Finally, I keep forgetting to say this at the end of these episodes. The whole mission of the Anxiety and Free podcast is to empower you to consider therapy. So prayerfully, I hope that this episode empowers you to consider therapy. If it has, please let me know in the comment section wherever you're listening and let me know your biggest takeaways from this session as well. All right, loves, I'll see you next time. The Anxiety and Free podcast is sponsored by Find My Therapist, connecting you with therapists at findmytherapist.us. If you found today's episode helpful, please share it with someone who might need it. Tune in next week for more conversations on navigating mental health and finding your freedom.